Ruby, welcome to Heart Podcast. How are you?
I'm really, really well. I'm so excited to see you again. I've
How are
been
you
waiting.
doing? How is so Ruby, I just want to tell you a little bit about this Heart podcast. I started this about 3 to 4 years ago, right before COVID started. And I sometimes patients' feedback to me is that they feel lonely in the journey, they feel exhausted, they want to know other patients' stories.
Yeah.
And I really wanted their voice to be out there. And the only way I can do that is through the podcast or through any social media to connect patients. And I know there are lots of social and fertility group out there already, but I thought it would be great for a doctor to facilitate a conversation and to help you express your whatever happened to you and how you want to share your story. So, Ruby, can we start with how did you find me? Where you're from? Why this is a Zoom? Where are you in the world? And how how your journey was. But let's start with how you found me.
Yeah, so my name's Ruby. I'm based in London, in England. I heard about you through a friend who actually lives in New York. She was recommended, um, she made the recommendation through a friend of hers who also attended your clinic. I had pretty much exhausted all of the London clinics who didn't want to treat me because of my age. I had also been to Spain and had treatment IVF cycles there. So
Yeah,
I'd
Ruby, remind me all those. Like, how old were you when you started? You told me a little bit of history. Again, you can share as much or as as little.
yes.
But
So
like, I remember you told me the long journey. When we
yeah.
first met each
So
other. So
I did 14 cycles. Um, Prior to meeting you, I had already done 11 cycles of IVF. So I had pretty much gone to the end of the road. You were my last chance. And my friend convinced me that it was a good idea to change a variable, and that meant change a country, go with somebody that's been recommended. So I looked at your background, I looked at the background of your clinic, and I thought after we had our first consultation, I thought you were the one. And I remember saying to you, you were the one. There was another clinic that I had consulted with in New York, but of the two, there was no comparison. I needed to be treated by you. Um,
and how old were
so,
you when this whole journey with the IVF started? Like Spain and England and like
so
all the
I
London offices.
started start cycles when I was 33, and I delivered my second child with you when I was 46. So probably about sort of between 13 to 14 years. Um,
But you
and
went through 10 years before you found me at how old you when we met? Ruby, like
I was
30,
45.
45.
Yeah, I was 45 when I met you. And at that stage, the clinics in London, for example, were the statistics of me conceiving with my own eggs was very, very low. They were not keen for me to be treated by them because there was a potential that I may ruin their statistics. Whereas when I came to see you, you said you would never say no to a patient trying with their own eggs. And even though the statistics of success were
And I was
low,
very honest with you. I told you
you were
also,
so
I
honest.
was very
You were
blunt
so,
about it,
yeah,
but
you were very blunt, but actually that accorded really well with me because I didn't want to spend thousands of pounds flying across the other side of the Atlantic for, on a whim. I needed to be bluntly told what my chances were. Um, and that's why I liked your approach.
Ruby, talk to me a little bit. How did you go through this? I mean, this 10 years, I mean, 30, I can imagine the day to day. Like, talk to me a little bit. Like, in a year, how many retrievals do you do? I mean, this is a long time. How do you find
Yeah.
that emotional strength? And yeah, just talk to me first. What did you do?
Yeah, I
Like
mean,
would they
it's
every year you go to
probably,
a different IVF center? I never
yeah,
asked you some of these details even when we met, but
yeah,
because I'm trying to
it
look forward, obviously, when
yeah,
we met. So
exactly. I mean, it was probably the hardest part of my life to date. Constantly doing IVF cycles and either getting a negative result or resulting in a miscarriage. And but I just couldn't. I had a picture in my head about what my family would look like. Although I never believed that I would have a girl and a boy. I thought for some reason I'd have two girls, but I never pictured sort of, the perfect family, but I pictured having two children. And I guess I was probably relentless in trying to make
and so
sure that
each year, what you will let's say 35 and then 36, you will go to different like IVF center because it failed. Like you would do 2 to 3 or
yes,
1 to 2,
yeah,
and
yes,
then you resume, you regroup.
yeah,
Now, if you don't mind, because obviously some of our audience can be American audience or
yeah.
audience from London. Like, what is the health insurance like? Is it like here is a private insurance, or how does London
So
work? And
so
yeah,
in London you have the National Health Service, which enables you to try I think maybe one, potentially two cycles of IVF, which is on the government, if you like, so you don't have to pay for that.
and that's for
But
all British citizen.
exactly, but up
Okay.
to the age of 40.
Okay.
And
Also, the
there
cutoff
are,
is 40.
yeah, the cutoff is 40, and there are also other caveats to it. So if you already have a child, then you're not eligible, for example.
Okay.
So there are, it's not a guarantee that you
I
have,
see.
two cycles. There's lots of criteria that you have to fulfill. But how did we do it? I mean, we got ourselves into a lot of debt. There's no two ways about it. Both my husband and I wanted it very much, but we would often disagree about how many cycles I would do because he could see how much emotional, psychological, financial investment I was making, we were making. But when you have this goal in your head and somebody as resilient as me, I didn't want to let go of it. Um,
The journey
and
was tough for me, Ruby, because I know this like a Zoom, but we also have lots of Zoom meetings or
yeah, I
Teams
used to call
meetings.
you and
And
cry to you.
I know, I remember that one of our last conversation before. I mean, we're going to tell the audience now how the IVF journey with me when you came to me at 45 and what happened that year. But it was not easy. I remember you're
No,
flying back and forth,
yeah,
calculating dates, and we were trying to
yeah,
do all this testing, some testing in London, some testing
exactly.
here. But there was a voice in you, I think,
Yeah,
because I was like, well, I think we were starting to talk about other alternative, like
yeah.
should we do something else
Exactly. So there are two things.
or third party
Yes,
donor
we had
egg.
to do, yeah, exactly. So logistically, it was quite tricky because I was doing, as you say, testing here, blood tests, I was doing scans, sending you the results. You were having to update and adapt the protocol based upon those results. And obviously, there's a time zone difference. So I was harassing you at times, when you were busy with other patients, but you were always so responsive.
Thank you.
But
Yes,
then
try it's hard.
one
Thank you.
thing you did suggest to me is don't cut off the option of using a donor egg. So you put us in touch with your colleague, Dr. Haid, and we did do all the testing for donor eggs, but using a donor egg for me was quite difficult to reconcile with emotionally, and culturally. Actually, it was very difficult for me to get my head around it, but it presented me with an option. And I think running a fresh cycle and a donor egg cycle in parallel, I think psychologically helped me to believe that I will have a baby at the end of it, even though my personal preference was to have a child that was biologically mine because its sibling is biologically mine. It just, I think, for other patients, I think, knowing that from your clinic they can run the two processes in parallel is very comforting.
That was important for me also. So I mean, we can go into what happened also during the IVF. I know you came to me with all these different protocols. It was pages of medical records. We talk about different style stimulation. I was going to use a different style, like mild, but with different alternatives and shots. I was also emphasizing on the lab, and so Ruby, let's go with that too, because then how we go into the bilateral process with donor, but let's talk about the initial when you met me and we talk about different processes. What were you searching for? Why me in a Generation X? There are so many IVF centers around. We went to many of them already, Spain, London, but why all the way here? What make me stood out that you're like, I want Dr. Luk to do this cycle? What were you looking for?
So I was looking for somebody who was very intelligent for a start, which not to say that the consultants in London
thank you. I love that, but lots of doctors are pretty smart, but thank you.
You're all very intelligent. You're all very intelligent, but you were very empathetic as well. I think I told you a little bit about my background, and you were very empathetic with that. And you said, you were just very honest with me. You said, look, the likelihood of it working, the likelihood of success is very, very low, but you would never say no to a patient that wanted to try with their own eggs. And incidentally or coincidentally, after years of negative results and miscarriages, we produced the most blastocysts with you at the age of 45.
And we did how many cycle here, Ruby? Remind me.
So we did our first cycle with you, fresh cycle, and we produced 5 blastocysts, all of good quality.
But we didn't test them, correct?
We didn't test them.
So we used a little bit alternative, whatever magic I put into the protocol. Then we got.
I mean, your protocol was so mild. It was actually stressing me out because I was like, what? Why am I not bloated? Or why don't I feel like overstimulated? I remember calling you and saying, should you not be giving me more hormones? And
yes, I remember. Oh, I love that question. I remember exactly. You asked me in that.
And you were saying, no, we need to follow your own cycle. It needs to be mild. And
then we got the most blastocysts ever. Like
most blastocysts ever. So
did we do the special sperm selection method or do we not? I forgot.
I don't think we did.
We did. So we just used the normal
we did Pixie.
Pixie. So we did. Yeah, that's what I was saying. Pixie. Yeah, I remember I did something like some magic.
Yeah, we did.
We would not tell the audience, tell people. So then we got the 5 blastocysts, right? We just
which I mean, I don't know what that is as a record for you, but for me that was a huge record because over a decade of doing fertility cycles, we had never managed to produce that many blastocysts, and at my age with my own eggs, I just thought was a miracle.
So with the 11, because you came to me, 11 or 12 IVF cycles that you were done, you were producing what, 1 day, 3? You did all. Like I remember you did transfer, you did blast, you did tested, not tested, like a bunch of them.
So I never tested actually. I never tested them. Never tested any of them. But on the most that I would probably have got from each cycle was about 3.
Okay. 3 but blasts. Not blast. Day 3. Oh, always blast. You didn't do day 3?
Yeah, day 5, 3. Sorry, 3 day 5 blasts. That would be the most that I would manage to produce. But with you, it was day 5, potentially slightly day 6, I think. But they were definitely day 5 blastocysts, and there were 5 of them.
Right.
So we did 1 fresh cycle with you, and we produced day 5 blastocysts, but you wouldn't let me transfer them because you said to me you thought frozen.
Yes, I always thought frozen embryo transfer is 1 or 2% better, because now we're more focused on the uterus. So it was a tough decision for me also because you're traveling so far. Lots of people who coming to me for 1 cycle, I usually let them do it because it's hard to schedule, especially there was some during COVID time, quarantine. It's really hard for patients to fly back and forth. But yes, we did. And Remind me, Ruby, again. I
So
think we
then,
had one. Yes, go ahead, Ruby,
so then I came back. I
for the
came back to
transfer.
New York.
Yes.
No, to do another cycle.
Oh, to the yes.
Do
Sorry,
you
there was
remember?
one
I did.
more. Yes, one more
Yeah,
IVF.
exactly. So I did one more cycle with you, but I only produced 2 blastocysts then,
Hmm.
but one of them wasn't of very good quality, so we ignored that one. So I was then left with 6 day
Hmm.
5
Yep.
blastocysts,
And they're all
and
untested for the audience
and
to
they were
know.
all untested. So we didn't do any pre-genetic implantation
That's
testing,
right.
because I was a bit nervous of doing that, and I think also. I think you said, which, and I sort of hung on your advice, was that nature would take its course. And if the embryo wasn't viable, then I would likely miscarry. And somebody like me who, I do believe a lot in science, but I also believe in Mother Nature. And I agreed with that. That accorded with me. That struck a chord with me.
It was hard for me though, because of the rare blastocyst formation that you had with the previous IVF cycle. I didn't expect you to have 5 in one cycle. And then I remember I started to say, should we do testing? Because I told you there are 2 types of patients that needed testing. One is history of miscarriage.
Mm,
Second is many blasts. Like, how do you
mm,
choose which ones?
mm.
But the decision was not to do that, to make sure we have some, because I know how much you wanted it. And there
Yeah,
were times like, why, what if the biopsy hurt the embryo, which can, but it's very
yeah,
less than 1%.
exactly.
So we went through the pros and cons. Like I told my patient, there's never a wrong decision. It's what right for you and your partner or your family.
Mm,
Because you can test, you cannot test. I have babies from all 3 choices. But the standard across the world right now is testing all blastocysts.
mm.
But we didn't choose that. We chose, just freezing the embryos.
Yeah.
Oh,
And we also talked about immune therapy. So
yes,
I've
because
forgotten the
now we're
name.
ready for transfers, and I,
Yeah,
I I may have explained to you the yours is like a garden. We need to
yeah,
plant it. We need to. I think this part was the hard part for us too, because now
yeah,
you are examining the uterus partly without Dr. Luke because you're in
yeah,
London.
yes,
And I was trying to direct all this testing,
yeah,
away, while you're there, and say, what is this, Dr. Luke? And I say, do it that day.
yeah.
Please make sure
Because I
there's a
I
good
I
doctor
I
there.
I I quizzed you about intralipids,
Yep, yep,
and
yep,
you
yep,
you
yep.
were less keen. You didn't want me
No.
to do them.
This will be
So
another day of lecture, but some of the audience are, in terms of intralipid reproductive immunology, and I may have told you they are not standard of care, and I worry. I don't know what can it do. I don't know there's no data. There's no data. If patient got pregnant with the previous babies and they got intralipid, I usually like I have patients right now coming me for a second baby,
mm,
and they did it with intralipid, then I usually don't stop it. I say, okay.
okay,
But if they don't, it's really hard for me, especially during COVID also with intralipid. They're supposed to suppress natural killer cell. There are lots
yeah,
of theory how it works. And we
mm,
don't know how does it work if someone get
mm.
COVID, if there's some other disease processes is happening. So,
Because in the clinics that I went to in London, it was almost like part of the protocol.
yeah.
You would have intralipids as part of your
Oh,
IVF treatment.
interesting. Interesting.
Um, so
Yeah.
there
In
was
America, you have to
when
pay a lot of money for that.
okay, so when you suggested that we didn't do it, it created a lot of anxiety for me because I was
Right. That
just
was
used to I was used to it. I was used to intralipid treatment.
right. Right.
But I went with your suggestion and we
Yes.
didn't use it. And
So
then
now how many transfer we did? We did one
so
frozen
then
embryo or
no,
2?
so then I flew back
Yep.
and we transferred 3
3. Yes.
embryos. So 3 out of my 6 blasts. Um, I got pregnant, but my HCG level was very low. I
Yep.
think it was 9. And you said to me, be cautiously optimistic because you have had patients where you have they have progressed, the numbers have doubled. But unfortunately, in my case, it didn't work. So
And I
the
think this
HCG,
is the time where you and I revisit to every
yeah,
question. Like, should
yeah,
we think about donor egg? Should we think about other options?
exactly,
I
exactly,
think at that point you share with me your the anxiety, the history, the you know, whatever that is causing you to chase for this. At the same time, what is causing you to really worry now? What if you lose your, you know, this is it, you're not doing IVF cycles. And I was nervous, and that's when I started saying, you know what, because we're chasing with that 5 or 10%, wherever 5%. I usually tell patients when they're 45. And you said, okay, Dr. Luk, I will look at other, because it was so much, I was crying with you. It was so much frustration or sadness that you went stick, but you didn't stuck all the way. And now we don't have lots of embryos left.
Yeah, so we have 3 left.
That's right.
3 left. And then I fly back again. And you and I discuss, do we put 2 back? Do we put 3 back? Do we put 1 back? What do we do? And I say to you that I want to put 1 back, because I just felt that every month your uterine conditions are different. And I was just nervous that if I put all of them back in 1 month and it didn't work, then I wouldn't have anything left. Then I would have to go down the donor egg route, because at that point I didn't want to do another fresh cycle. So we decided, and you did my transfer. We decided.
I still remember that day.
Yeah.
I know you have one of your favorite clinical assistant who works with me, passionate about you, by the way, to hunt me down to review your blood work. You do have an amazing health advocate at my office that is like, it's Ruby blood work, you need to review now. Like, I just came out from the bathroom now, and I'm like, okay.
Well, I think you were with another patient.
I was, yeah. Well, it doesn't matter. It's back to back. It's like right after this interview, they may be chasing after me. And sometimes if I walk away, that delay another 10 minutes for you not have your results or direction.
Exactly.
So they
came in.
They turn me towards wherever it is.
You squeezed me in. You squeezed me in.
And I squeezed you in.
We transferred one of my 3 blasts left.
But you remember that lining that day? I was very nervous. I don't know if you know.
Were very nervous, yes.
Because the lining was not as optimal, but we already canceled 1 transfer cycle.
Exactly.
So this was our 2nd transfer cycle.
Yes.
And well, not second in the sense of 2nd transfer. It's just that I canceled last month, and now flying all the way. And you were flying not just directly from London, you coming from somewhere. Like that was, I forgot which country, like you're continent hopping. I don't know where you were.
Well, so I was coming from London. Oh,
London, okay.
But we did cancel 1 transfer before I came out because my lining wasn't thick enough.
Okay, you were not in another continent. There was 1 more location before you flew in. I don't think it was.
It felt like I was.
It was 1 more.
No,
you were not in Africa. Any other country during the whole
I went
transfer?
on holiday to Dubai.
That's it. So you were somewhere, but then you have blood work, because not all the blood work in 1 cycle. Do you remember?
Yes, I completely forgot. You are completely right.
Because the time zone, we had to calculate which blood work, what time zone you're going to get. For me to have the conversation with you, because you were so nervous. So you know, not every patient gets to talk to me. So I remember that
actually. It was 2 countries. So I was on holiday in Dubai.
Yes.
So I had to go and do scans and blood work and send them to you. And they are 4 hours ahead of UK, which I think is 9 hours ahead of you.
Right.
And then I also went on holiday to Italy.
Yes.
And Italy is an hour ahead of the UK, which is 6 hours ahead of you. So
yes, I had to calculate, because now the whole transfer cycle is 3 weeks, as you may remember. I have like day 2, day 8 is a different country, and then day
I forgot about that.
And then you have different sonographers, obviously, because they're 3 different continents. And and then the lining, but then it was really thin when you came to me. That cycle.
So the cycle,
but it looks right. I can't reject you on that morning. You know, I double checked it, but I didn't want to go through.
I think it was like 7.5.
It was, I mean, I can go
it was
further. It can be 5, it can be 6 to 7, you know, like at the average, but it was thin, believe me. I sometimes I look back at your lining, is it thin? And then we transfer the one and only. The one and only.
And that's my son. Yeah.
How is he doing?
Yeah, he's all right. He's 10 weeks now. He is hard work. He keeps me awake most of the night, but I adore him. Absolutely adore him. Like,
I'm so happy for you. Ruby, and it is really persistence and resilience. I think resilience is more like it.
I need to calm down. I need to stop crying.
Oh no, no, you do what you
But
need.
I
This is
just,
also like a therapy session for the
but I
doctor and
also,
patient.
but I
What a
do
journey.
feel. I mean, when you asked me to do the podcast, I leaped at the chance because there must have been you did something. Either it was your protocol, or it was your lab, or it was something, but it was your clinic and it was under your guidance that, for me, it's made all the difference. I did 11 rounds before I met you, and I've never ever produced as many blasts as I did with any other clinic. So, I mean, there must be something in that, right? They're
Yes, yes.
just
We're trying to piece out the science also for some of our rare, patients. And I mean, that's how you found me. That's how Generation X came on growing. I'm growing as a human, as a doctor, learning what is. I mean, obviously there are patients who failed, and I try to figure out also why. Is there any other way? But there also a voice. I really believe in that voice in patients, because I don't want people feel, one of our doctors just had a speech about persistence, but there's still limits. Like, I think we try to draw the lines, but at the same time you have something. And I remember it was very spiritual. The way you talk about it is a voice in your
yeah,
heart, that I
yeah,
was the one, first of all, and that you wanted this to happen.
yeah,
You felt you've wanted to do this, because I keep on counseling you. The 95% they may
yes,
work, because I
yes,
want to be as honest, since I'm your 12th, 13th, whatever, 13th cycle. And so, but you did it. It's all,
and
and I truly believe in that voice, and not that, and I don't know this meant for everyone. Like, that is a very spiritual thing.
yeah,
And if you felt it, and that is, then
yeah,
that, but it's very hard.
yeah.
I'm not easy what you
I'm
went through.
definitely, I'm very religious, and I am also, bound or constrained by my culture, and I think you are a little bit as well. And I think that's probably why I was able to empathize with you. I think, I had mentioned that it was quite difficult for me. It would have been quite difficult for me to have used a donor egg, and just because of the cultural restraints, and you understood that. And I think other cultures probably would be less understanding, empathetic, which is so. I think we shared a commonality in that regard. Um, and you stuck with me. You stuck with me. You stuck with me. I mean, I remember speaking to one of your clinical assistants and saying, I really want to speak to Dr. Luke. I really want to speak to her. And, we're 5 hours ahead of you, but you would always make time for me. And I'll never forget that. I'll never forget that. So I think having that consultant patient connection is really rare. Very often you get fobbed off. I don't know if that's a phrase that you use in America, but fobbed off means, you'll just be passed on to somebody else, somebody less senior in the team. Whereas your treatment was consultant led. And that, especially, for example, in London, that's quite rare. I can't talk of other clinics in America, but to have that connection with you, that one-to-one time, and your responsiveness and your guidance it's made all the difference. I owe so much to you. I owe so much to you. When I see my daughter and her brother together, it's the
Oh,
best moments of my life, like literally the best moments of my life. Um,
no,
so
really, yeah. So I'm not going to,
make me cry
make
anymore.
you cry anymore, because you have said everything. Education, empowerment, empathy is our three E's that I personally strive for. And as an organization, I need my team. You can see my some of my staff member were very close to you, knowing how much you have struggled, and
Yes.
I
Yeah.
want that staff to work for me, and that compassionate, because sometimes they had to, through them, I know how eager, right?
Yeah.
If no one really alarm me, I would not know, oh, Ruby really really wants to speak to me. And And that's very important. And I'm very lucky to have amazing compassionate staff member that help you to give all your blood work to me when
Exactly.
it's time.
Yeah.
Squeeze out time
They
in.
were
So
all so helpful. Your lab, I remember, would send me the best emails trying to keep up my positivity. They're just every day the updates on how the embryos were doing. Your clinical assistants running around trying to get my blood work to you. Even though I was 5 hours ahead, I never felt stressed
right.
by the process. I knew you would respond.
It's not easy though. Ruby, I mean, what you have gone
I'm not
through,
an easy
how
patient.
oh no. Oh yes, it's not an easy case. But Ruby, as we're wrapping up, I want to ask you one last question is how, if there's one message you want to send to other patients who are going through this journey, what do you want to say to them?
I think it depends how much you want it. If you really want it, if you picture how your family looks like and you can cope with it emotionally, psychologically, I think you just don't give up. I genuinely believe, age is important, obviously, but if you bear in mind that, the risks, the stats are against you, but you still want it, then change a variable, do something different. Just, like a professor wouldn't be carrying out the same experiment again and again and again without changing a variable. And with you were my change in variable. Your protocol was different. Your treatment of me was different. You were in a different country. The way you spoke to me was different. Your lab was different. So I think for your patients, they need to change something,
Right.
and that will help them feel they've got a bit of control and keep at it. If you want it, keep at it.
Ruby, how do you find those strengths? You're just amazing. It's not easy.
Well, I'm
10
exhausted
years.
now, sleep deprived now.
Get some rest. Get some
Yeah.
rest. Well, Ruby, it was a pleasure having you on here on my podcast, and it's like a dream come true for you and for me. You were one, not the toughest one, but some of the toughest cases I have had in my
Yeah.
career, and you did it. There's in so many ways.
We did it. We did it.
We did it. Okay.
We did it. We did it.
Thank you so
I'm
much.
Okay.
Okay.
We'll
I will
speak
talk to you
soon.
later.
Talk to you later.
Bye.
Bye.